Heart health for women.
Very good question. Are you listening to your own body? This is Dr. Marjan Fariba. So we're talking about a little bit ago during the commercial break. Lots of people seem to be having friends in their 40s, which is very young, but starting to have issues with heart health, strokes, all these things. But you're saying that the anxiety and stress factors really go into that.
Stress is a huge deal. Yes, unfortunately, not only does stress play a factor in creating risk factors, but also it affects the risk factors you already have.
Right.
Someone who's stressed out may not be so conscious about eating all kinds of colored fruits or vegetables because you're thinking about other things. What's more accessible? Coffee with a lot of cream and sugar and fat. Those are comfort foods that people gravitate towards when they're stressed out. Also, stressed out people may not be so much thinking about exercising. And so stress is a huge factor. Exactly, yes.
Right?
Stress, and you know, what you're doing is stretching your muscles and building muscles, which is actually helpful for your heart. Yes. In the past, it used to be thought that only aerobic type of exercise was healthy, but now we understand that actually building your muscles and strengthening them helps the heart as well.
Okay, so let's talk about the heart and what happens when you start to feel discomfort or a heart attack, because it looks different. Some things look different for women than it does for men.
Very true. So first of all, let's make sure we understand part of the reason things feel different for women is that they are not aware. They don't think about having heart problems. They think about, they're afraid of getting breast cancers or some other problems, but heart disease is not top on their list of problems that they need to watch out for.
Even though it's number one killer.
Even though it's number one killer for women as well as it's for men, but men are more aware of it. So some of the symptoms may not seem so bad, and so they may not think about it. But the symptoms, pressure and pain. So every time a doctor asks you how bad is your pain, a lot of people think, I don't have any pain, but it's actual pressure. Whatever that shouldn't be feeling up here, that's your pain. That's
if it's abnormal,
what it is.
that is pain.
And extreme fatigue and just exhaustion. But there's so many things that make us feel exhausted. So again, people don't think about it. But if it's something out of ordinary, that you're having this symptom that you shouldn't be having, think about heart disease. Jaw pain, shortness of breath. Those are all symptoms of heart disease.
And when you say jaw pain, is it like a sharp pain? Is it a soreness?
No, it's mostly a throbbing and just a pressure and just ache, an ache that shouldn't be there. And so people think, oh, I've been having this jaw pain or toothache. It's not a toothache, it's your heart. Because the nerves that are going to the heart also affect the upper body, your jaw and your chest. Everything, it's one person. Everything is connected.
Wow. All right. This is Dr. Fariba again with Kaiser. We're going to link the information to Kaiser's Heart Health to our website, gooddaysacramento.com, under show info and today's date. Again, pay attention to your body. If something's not quite right, or just even if you're just not even sure if it's quite right, call the doctor. That's why they're there. Go see them.
One important factor, when it comes to heart health, we say time is muscle. So if you think you have heart disease, if you think you're having a heart attack, you go to the emergency room. It's much better to be inconvenienced by somebody telling you, no, it's not your heart, than to have a heart attack and for it to be too late for us to do anything about.
Time is muscle.
Time is muscle.
I love that. Dr. Fariba, thank you so much.
Thank you.
All right, guys, back over to you.
Thank you so much. Important stuff.